Egg freezing has become more popular in recent years as some women opt to preserve their fertility for a number of reasons, including not being ready for parenthood, risks of premature infertility and having certain medical treatments. This week on Medical Matters, we find out more about the reproductive choice of freezing eggs and what this entails for women. Leanne Manus is this morning broadcasting from the Santin Mediclinic and will be focusing on this crucial reproductive health issue of freezing eggs for fertility purposes. And we cross to her right now. A very good morning to you, Leanne. Thank you so much for joining us. Over to you.
Simpiwe, it's wonderful to be with you this morning, and yes, bright and early coming to you from the Santin Mediclinic. And today I'm very happy to actually be taking on this Medical Matters slot. I haven't had the opportunity to get out of studio and actually do it as yet because it's been so busy and we've been covering so many massive stories. So it's now wonderful to be able to come and actually talk medical matters. It's probably one of the most important issues that affect women, and particularly women that obviously want to start families but have problems when it comes to whatever it is, their reproductive health. Medical issues have a massive range of problems from, it doesn't matter where you talk, but these are issues that affect every single person. But today we're talking reproductive health, and this is why we find ourselves at the Santin Mediclinic, and quite an interesting place we find ourselves, and one that I think a lot of women, if you have been through this, may bring some very difficult memories, may bring good memories, but it also may bring some bad memories. If you have gone through IVF, if you've been successful, what an amazing thing. If you haven't, then of course it doesn't bring good memories, but certainly if you're going through it right now, we do hope that we'll be able to provide you some comfort and also talk you through the journey of not only those that actually help you with it, but I'm going to speak to somebody who does both, helps you with it and has been through it herself. Such a pleasure to be here with you this morning, Chantal van Tonder, who's the practice manager and IVF coordinator. So this is a very different morning for me. I never sort of have to come to the doctor's rooms at this time. I'm usually away from here, but this is your normal life. So talk to us a little bit more about IVF and, you know, how common it is and how difficult the process is.
Well, I think it's more common, Leanne, than what we think it is. I mean, I personally have gone through the journey. I was diagnosed with a stage 4 endometriosis with PCOS, and I also started late. I only had my first baby at 31. So the later I left it, you know, the more the problem started sinking in. I think that's what's important about going through this IVF journey, is that you have to really be in a good mental space, because it is quite trying on both husband and wife. I've lost a baby in between my 2 pregnancies, and I've got a 5-year gap. So it's also sort of, for me, I had to resign myself that God will give me what I can handle. And it was a long journey. It's a long, trying journey, and the anxiety that goes with it is quite overwhelming. But what I can say is that here at our practice, we, because I've gone through it and because Dr. van Tonder has gone through it, we understand the patient's pain, we understand the relationship between the husband and the wife, we understand how to counsel these patients, and every patient that comes to our practice, we know your story and we care about what you're going through.
It does make it easier when you're dealing with people that know exactly what the process entails and how difficult it is, and that psychological issue, because that's something I really want to touch on. Many people, you try and get on your daily life as if nothing's going on, but, you know, it must be so difficult psychologically, and the toll that it takes on you mentally for going through IVF and the successes and the failures and coming back and repeating it, and the disappointment when you do a test and it's not pregnant, or that it happens that it is and then you lose the baby. I mean, how do you help people going through this psychologically?
Well, I think what's most important is that the expectations for an IVF and the positive outcome for the IVF is already established right in the beginning for the patient. Unfortunately, there are patients, like you have mentioned, that do not fall pregnant. There is there is a percentage of patients that don't fall pregnant, and it's undisclosed fertility. So you don't know why. You've done everything right, all the boxes are ticked, but sometimes it just works out like that. For us, we need to, we counsel our patients right from the beginning, and we actually send them to a psychologist and she will deal with the expectations and what the journey is like and what the steps are. We in the practice will guide the patient every time they come. We will counsel and say, right, the next step is X, Y, and Z, and this is what you can prepare yourself for. And so I think their expectations on what the next step is already verbalized from our side. So it does take a little bit of the anxiety away, because they know what to expect in the next step, and we give the patients opportunity to ask questions throughout the journey.
Yeah, it's interesting what you say, and I know we're going to have quite a nice in-depth conversation with Dr. van Tonder about all of this, about misconceptions around a lot of this fertility treatment and freezing eggs as well. Because they are, I suppose people don't know too much about it if you're not involved in it, but it's also a costly affair. But at the same time, if you have the means and you're able to, what is, for what you working in this industry, what is the biggest misconception about it?
Well, I think the biggest misconception is that we have eggs that are going to be normal for the rest of our lives. Unfortunately, as women get older, we do get abnormal eggs. Dr. van Tonder will explain to you now the percentages of age as your AMH drops. So for me, I've got 2 daughters, and so I'm going to be quite passionate about the fact that if they are climbing the corporate ladder, that they do egg harvest. Between the ages of 25 and 28. If they're not in a relationship and they're not getting married yet, or whatever the case may be, I'm quite pro the egg harvesting, because I've just realized that we sort of put it on the back burner and say, oh, we've got time. But in actual fact, we don't. Yeah. And so our genetic material in our oocytes that we produce does diminish. Yeah. And then we sit at 40, and now we're having to do IVF after IVF after IVF because of genetic abnormalities.
Amazing. Well, listen, I was one of the lucky ones, and I was blessed for it, but I do know I was having the same conversations with myself. No, it's so early. 33 was when I had my first child, and that's late. That's very, very late. But as I say, was one of the lucky ones. It is a big journey. But this is not where we end the conversation. This was kind of just the beginning. But it was so nice to chat to Chantal, who is a success story and who works with other patients that do come and want the same procedure. So, Medical Matters, focusing in on all of these issues and more. We'll be back with you just around about 8:45 when we'll have a conversation with the Dr. Chantal. Thank you. Great chatting to you, and love the story. Absolutely love it. We'll see you shortly. Let's go back to the studio.